Welcome, this is Josh with PolicyStat. We're really proud to present this webinar for you that we're calling 6 Steps to Stay Inspection Ready. We have Kathleen Irwin, who will be presenting today, and a couple of housekeeping to actually get us started. So you're not going to hear much from me, especially on this front end, but we're PolicyStat, the software to help manage documents. We do serve a lot of hospitals, health systems, as well as a lot of clinical laboratories. Again, I'll talk more about me at the end, but most of you are not here to hear me talk, so we're going to jump to Kathy pretty soon. One thing we have provided for this webinar is in the GoToWebinar panel kind of menu that you see on the side of your screen, one of the pieces in there is called Handouts. And we have this PDF handout that you can go ahead and download. You can glance through it during our presentation. Some people like to take notes on it if you were able to print it beforehand. But that is available to you. I think we'll also follow up with you should you want it later. You weren't able to get it in the session. Also, there is a questions section of the GoToWebinar panel. So you probably will have questions along the way. Look for that section. Go ahead and type them out in there. We're going to have a question and answer time at the end. So I just want to really highlight that to make sure you are aware of it. And then with that, I am going to mention just a little bit about Kathy. So it's been really great to work with her, just kind of hear her background. Kathy has been in the lab world for a lot of years. You can see her background on the screen there. And it's really interesting from my perspective. I personally don't come from the lab world, so I'm not quite as thorough and articulate and just really robust with all of the information and all the regulations that the lab world has to go through. Kathy is. So it's been really fun for me to hear through the practice rounds of this presentation to understand what she's going to be walking through. And goodness me, she is really thorough and so good at it. So sharpen your pencil. She's going to have a lot of great information for us. Last piece, Kathy, before I hand it over to you, is we have a poll that we're going to start off with. And really it's just to help Kathy and others here understand what environment the audience is coming from, because we know folks are coming from different places. So this really gives a gauge. So if there are a few items that we may need to sprinkle in the conversation, this is worthwhile for us to appropriately gauge what you may care about. So we'll leave this open for maybe another 30, 45 seconds. All right, well, thanks everybody for going ahead and filling that out. Looks like, Kathy, just for your knowledge here, about a third of the folks joining us today have their documents on a shared drive. About a third say, good question, maybe a paper manual. About 25% use a software for it, and then the remaining percent are either on like a SharePoint or a homegrown setup. So there's the background, and Kathy, if you are ready, I am going to hand the floor to you to go ahead and get us started.
All right. Thank you very much, Josh. I'll try to live up to that beautiful introduction. Okay. Well, inspections really are designed to evaluate your compliance with the overall quality standards set to measure the accuracy, reliability, and timeliness of the patient testing being performed at your facility. So why worry about inspection readiness, you might ask? Well, we're all familiar with the overwhelming workload and high stress levels that can be associated with preparing for an impending inspection. After all, a poor inspection can cost an astronomical amount of time and money and could potentially put you out of business. Essentially, we should be operating at the inspection ready level at all times to produce the highest quality patient results. Today we're going to explore several tips and tricks to assist you with maintaining your inspection readiness so that your entire facility may perform more efficiently and effectively while producing higher quality results, thus providing better patient care and improving the overall patient experience. While being ready can't guarantee a stress-free inspection, it will demonstrate a culture of quality and will put you on the path of continual improvement. So what exactly does inspection readiness really mean? Being prepared for an inspection includes addressing any previously cited deficiencies, as well as satisfying all the current requirements for the inspecting agency's current survey checklist items. Now let's review the self-assessment process. The best way to assess overall compliance with any set of regulations is to conduct a mock inspection. These audits may be performed internally or by a third party. It proves to be very effective to use personnel from each department to inspect any other department than their own. While they may be familiar with the regulations and requirements of accrediting agencies, they'll be more likely to see the nonconformances in an environment they're less familiar with. It's easy to overlook something you see every day. Next, let's discuss whose regulations we should comply with. Compliance with the Clinical Laboratory Improvement Amendments, CLIA, requirements is a prerequisite for receiving reimbursements from federally funded programs such as Medicare and Medicaid. Both CLIA and CMS, the Centers for Medicare and Medicaid Services, require biennial inspections for all accredited facilities to maintain their certifications. However, yours may also be subject to inspection by a host of other federal, state, local, and professional agencies for compliance with regulations based on the type of services your facility provides, the testing you perform there, and the licenses and certifications you hold. The most likely inspections one might expect includes OSHA, the Occupational Safety and Health Administration, OCR, the Office of Civil Rights, which is responsible for enforcing HIPAA, which is the Health Insurance Portability and Accounting Act, which protects patient confidentiality and privacy, the Joint Commission, the College of American Pathologists, FDA, and the CDC. Although many of the agencies and surveyors provide notice of an impending inspection, they have the authority to enter and inspect any accredited facility at any time, even with no advance notice at all. In fact, all OSHA inspections are conducted with no advance notice at all. The goal for all managers, then, is to be prepared for all inspections at any given time. The successful strategies used to manage regulatory compliance and inspection readiness on an ongoing basis include knowledge, awareness, and good practice management. Knowledge of the regulatory process provides a framework for maintaining inspection readiness. Understanding how the regulatory and accrediting agencies work together and knowing which agencies will inspect and accredit your facility allow you to confidently prepare for the inspection process. Awareness of how regulatory standards are currently being interpreted provides an opportunity to fine-tune your responses to the survey checklist. Additionally, you must accept that even though the regulations have been in place for many years, interpretation of those regulations changes over time because of technological advancements, enhancements in the industry, evolving understanding of the regulatory process, and changes in the clinical utilization of the information produced. To maintain compliance, the methods and processes we adopt and manage must also evolve as well. Another vital component of preparedness is using best management practices. Effective leaders promote engagement at all levels of the organization, making sure each person understands and fulfills their role in the regulatory compliance process. Regulatory concerns need to be considered in the everyday decision-making process when it comes to staffing, equipment, ordering reagents, controls, etc., allowing leaders to develop creative solutions that improve efficiency and reduce costs while meeting regulatory requirements. This combination will result in improved survey outcomes. The first step in preparing for an inspection is reviewing the previous inspection results. Conduct a re-evaluation of deficiencies and corrections made, and revisit notes from any close calls over a period of several inspection cycles. If you have performed internal audits, Review the results and corrective actions taken in response. Also consider any observations noted or suggestions made by any previous inspectors. Ensure that corrective actions taken have been well investigated, properly documented, and that staff has been thoroughly educated on any changes to processes or procedures. Verify that follow-up has been done to demonstrate the effectiveness of those actions, that the policies and procedures have been updated appropriately, and that the corrective steps have not negatively impacted any other processes, and that the remedies have remained in effect. As your next step, you'll want to identify the most commonly cited deficiencies for the industry. Over the past few years, several issues have consistently ranked near the top of the list, and many of them merely the lacking of proper documentation. Among these, personnel qualifications and records, competency assessment, proficiency testing, expired reagents, and the proper storage of reagents, materials, supplies, and specimens seem to be frequently noted. CLIA regulations are divided into conditions, and each condition includes a group of standards. A CMS deficiency can then be classified as standard or condition. Condition-level deficiencies are more serious and carry higher penalties than standard deficiencies. Personnel requirements and qualification issues appear in 6 out of the top 10 most cited condition-level deficiencies in the nation, as reported for 2014 and 2015. CLIA clearly defines staff qualification requirements based on testing complexity levels performed at the facility. All staff must be qualified at the level of the highest complexity assay performed. Leaders should consider creating a crosswalk of current job descriptions with the CLIA personnel standards to ensure that education, training, experience, and competency requirements are met and properly documented for all positions. It is important to check the text complexity database when implementing updated technology or when changing assays for any given analyte. Should you be testing using an analyte-specific waived assay and change to a moderate complexity assay for the same analyte, you must ensure that all levels of staff are qualified for moderate complexity testing, including your directors. The same applies for changes to or implementation of high complexity assays. Personnel files must be readily available and complete for every person performing testing at the facility. For proof of education, diplomas and transcripts should be obtained. For individuals educated outside of the United States, a translation must be available. Not a literal translation, but an equivalency statement which can be obtained from a business dedicated to this service. Training checklists aid in documenting initial training for new personnel, as well as for documenting training of current staff on any newly added processes or equipment. To ensure compliance with competency evaluation requirements, make sure you have a clearly defined and well-written policy that incorporates direct observation, review of records, performance of maintenance, assessment of test performance, and problem-solving skills. Thoroughly documented initial training, assess competency at 6 months and then annually thereafter, and define and record any remedial action taken for personnel failing competency assessments. Personnel records for the director must also include a license to practice medicine in the state where the facility is located, and documentation of the level of education, experience, and training that qualifies them to serve as a director. For technical consultants, credentials, including college degree and proof of experience, and performance evaluations should suffice. For all other testing personnel, files must contain proof of highest level of formal education, training records, and competency assessments. For all personnel, annual continuing education records should be retained, for which training attendance sheets are generally acceptable. These courses are not acceptable as replacements for training or experience. In addition to personnel record issues, proficiency testing issues have ranked near the top of the most cited list for several years now. The most common reason is personnel not treating PT samples the same as patient samples, followed by attestation forms not being signed properly, then by corrective action not being performed for failed PT events. Participation in PT is required for all regulated analytes tested. As for non-regulated analytes, you can enroll in PT or use the biannual verification method. To ensure compliance, enroll in PT for all regulated analytes each year, and for non-regulated analytes, enroll in PT or develop a biannual verification policy that tests at least 2 samples per analyte twice per year. Check the attestation statements for signatures of the director or his designee and the testing personnel, and document the review of PT or biannual verification results and any remedial action to correct problems or failures. PT serves as a test of your processes, the competency of your staff, and is a good indicator of the level of quality in your facility. Another topic making the list for multiple years in a row is proper storage of reagents and specimens. The criteria must be consistent with the manufacturer's instructions if provided. The conditions must be monitored and documented and must include water quality, temperature, humidity, and protection from electrical current fluctuations or interruptions that could potentially affect test results or reports. You can also avoid being cited for expired reagents and materials by educating staff members to use established procedures and schedules to check expiration dates of supplies and reagents prior to use. Randomly audit in-use supplies and reagents to identify upcoming expiration dates. Determine criteria, establish ranges, and maintain appropriate documentation for temperature-controlled spaces and equipment. Include the monitoring of room temperatures for reagents stored at such, or if the manufacturer specifies a range. Record temperatures on each day of business. Document corrective action when temperatures are outside of acceptable limits. Re-record temperatures several hours after any adjustment to any thermostat, and make sure the thermometers are calibrated and reading accurately. The last common deficiency I will discuss today deals with standard operating procedures, better known as or referred to as the procedure manual. Many agencies will hold a facility accountable to the procedures or standards they have set up for themselves, even if they prove to be more stringent than the regulation requires. Ensure that you have properly documented SOPs for all the processes being performed in your facility, that all staff members have been educated and are complying with the current versions of the written processes. All SOPs must be current, comprehensive, and signed by the director. Package inserts, manufacturer's user's guides, quality assessment plans, and reference laboratory manuals should all be included in that procedure manual. The procedures must include the site-specific information, such as corrective action for unacceptable QC results and course of action if a patient test is unable to be run for any reason. Discontinued and retired procedures and package inserts should be removed from the area containing the current SOPs, clearly marked with the date of retirement, and retained for up to 2 years. Step 3 is to identify and review the hot topics and newsworthy issues currently shaping the industry and use them to preempt any changes that may need to be made to your existing processes and procedures. Demonstrating you are actively monitoring potential industry advancements will show your commitment to continual improvement and providing an enhanced patient experience. One such hot topic is, for example, individualized quality control plans. IQCPs have been a hot button topic since early 2016. It is a voluntary alternative quality control option that provides equivalent quality testing to meet regulations for non-waived tests. IQCP offers you flexibility in achieving compliance with your current test systems. It also allows you the ability to adapt to new and future technologies while still meeting the regulatory requirements. You may customize your QC to your specific environment, patients, personnel, test systems, etc. IQCP considers the entire testing process, pre-analytic, analytic, and post-analytic processes. Thus, you will need to consider the corresponding risks in each of these phases and applicable regulatory requirements. Point-of-care testing is another hot topic area that inspectors may scrutinize more carefully these days. Advances in POCT technologies are evolving, and this market segment is growing at a rapid pace. CLIA-waived self-testing does not require quality assessment or proficiency testing, but in the hospital, both QA and PT are required. While the FDA, along with the CMS, has taken the lead in addressing the differences in the use of self-monitoring and professional point-of-care devices by establishing new performance criteria, the accrediting and standard agencies have not yet kept pace with this initiative. It is important to have this perspective as innovative technologies enter the market and affect patient care. Performance criteria for these devices must change to assess the quality of test results, not just in real time, but continually over time. And the time has come to develop a new plan based on the significant volume of patient data generated by these devices at the point of care. Looking forward and keeping up with the latest news and related practice advancements concerning the industry will help you stay apprised of the latest developments in technology and help you strategize for compliance as the trends and regulations evolve. The next step in preparedness is to physically survey your surroundings. Visually inspect your entire facility for health and safety risks and hazards. Take note of any potential issues that could affect your operations or threaten the well-being of your staff. OSHA insists we must provide a workplace free from recognized hazards. A crucial step in protecting worker health and safety is learning to recognize workplace hazards. Most hazards fall into one of three categories: chemical, biological, or physical. Potential exposure to chemical hazards can occur both during use and with poor storage of items like cleaning agents and disinfectants, drugs, anesthetic gases, solvents, paints, and compressed gases, among others. It is our responsibility to identify hazards, determine employee exposure, develop a chemical hygiene plan, and define a standard operating procedure addressing the hazards and precautions required for safe use. We are also required to provide material safety data sheets and employee training. Biological hazards include potential exposure to things like allergens, infections, bacteria, and viruses. Health and safety issues such as containment and potential biological effect are important to ensure that procedures can be conducted safely. The most prevalent biological hazards in terms of frequency of occurrence are simple allergens associated with the use and care of laboratory research animals. The category for physical hazards is the largest and most common and includes slips, trips, falls, ergonomic hazards of lifting, pushing, pulling, and performing repetitive tasks. Electrical, mechanical, acoustic, and thermal hazards also fall into this category, often go unnoticed, and can have potentially grave consequences. Many operations can result in workers assuming sustained or repetitive awkward postures. What is found acceptable for brief or occasional use may become problematic if performed for long durations or very frequently. Pain is a good indicator that something is wrong. Conduct your work with a neutral, balanced posture. Many injuries stem from poor housekeeping. Slips, trips, and falls are very common but most easily avoided. Start with safe and organized storage areas. Material storage should not create hazards. Bags, containers, bundles, etc., stored in tiers should be stacked, blocked, interlocked, and limited in height so they are stable and secure against falling. Keep all your storage areas free from any accumulation of materials that could cause tripping, fire, explosion, or pest harborage. Electrical hazards are potentially life-threatening and found much too frequently. First, equip all electrical power outlets in wet locations with ground fault circuit interrupters to prevent accidental electrocution. GFCIs are designed to trip and break the circuit when a small amount of current begins flowing to the ground. Wet locations include any outlets within 6 feet of a water source, located outdoors, or in any area that gets washed down routinely. Another very common electrical hazard is improper use of flexible extension cords. Do not use these as a substitute for permanent wiring. The cord insulation and plug-ins should be inspected regularly and should be in good condition. Never repair cracks, breaks, cuts, or tears with tape. Be aware of potential tripping hazards when using them and only use grounded equipment and tools. As a final check for possible electrical hazards, look over your lighting. Protect all lights within 7 feet of the floor to guard against accidental breakage. Slip plastic protective tubes over fluorescent bulbs prior to mounting, or install screens onto the fixtures. Walk through your facility with a keen eye for safety and common sense issues such as trip and fall or fire hazards. Walk the entire facility using all the potential walkways and check the floor and work surfaces for protruding nails, splinters, holes, loose boards, clean and dry floors, and properly maintained drainage systems. Are all working areas, passageways, and storerooms clean and organized? Are aisles and passageways marked on the floor? Use a checklist to measure the width of your walkways, doorways, and the distance from heat sources, etc. to ensure compliance. Exits should measure no less than 28 inches wide, and the direction of egress should be clearly indicated. Make sure that hazardous materials, chemicals, and other liquids are stored properly in closed, approved containers, labeled, and stored in cool, well-ventilated, fire-resistant storage rooms. Routinely check for expiration dates on chemicals and liquids and provide regularly inspected portable fire extinguishers in multiple clearly marked locations. Reasonably comfortable, durable, easy to clean eye and face protection should be provided to all staff at risk of potential exposure, and respirators and training must be provided when necessary. Check to make sure that exit routes are clearly marked on floors and walls, are unobstructed, unlocked, and that the number of exits is sufficient to satisfy local codes. Make sure that fire alarms and sprinkler systems are present and routinely inspected and tested, and perform periodic evacuation drills with your entire staff. With proper guidance, a trained eye, and practice in noticing the hazards, we can identify and correct many common mishaps, preventing illness or injury. The next step is the inspection itself. The outcome of a survey is based on the condition and documentation at the time of the inspection. Familiarize yourself and your staff with the regulatory requirements as determined by your inspecting agency. Having the following items neatly organized and readily available for your inspection will greatly improve your overall results. You'll need a copy of your current CLIA certificate, your previous survey reports and corrective actions taken, your personnel files, including complete documentations for licenses, certifications, job descriptions, proof of education, including diplomas and transcripts, initial and periodic training records, annual performance evaluations, annual competency assessments, and confidential vaccination records. You also need your procedure manual containing all current comprehensive standard operating procedures performed in your facility, all signed by the director, including all package inserts, manufacturer's user guides, quality assessment plans, and the manual for your current reference laboratory. These procedures must include site-specific information such as corrective action for unacceptable QC results and the course of action if you are unable to run a patient test for any reason. All discontinued and retired procedures should be clearly marked with the date of retirement, retained for 2 years, and in a location other than that of your current SOPs. You also need documentation of enrollment and participation in a proficiency testing program appropriate for your test menu and specialties. All PT records, signed attestation statements, handwritten records, instrument printouts, documentation of investigations and corrective actions, and they should all be readily available for your inspectors. You should also have documentation for all of your instrument and equipment installations, calibrations, validation studies, maintenance records, temperature and humidity records, service reports, and quality control performance records. You should also have supporting documentation for verification of the security of your LIS system, as well as the accuracy of the data entered and stored within that system. You should also have supporting documentation for all of your quality assessment, including assessing quality throughout the testing process, taking corrective actions when needed, and following up on effectiveness of corrective actions. Include all quality control records, charts, and logs involved. After the surveyor has toured your facility and reviewed your documents, they will provide a summary of findings and provide guidance concerning any corrective actions needed. A written report will follow within a few days with detailed instructions for how and when to respond. Lastly, it is important to look forward and keep up with the latest news and practice advancements. Staying apprised of the latest developments in technology will help you strategize for compliance as the regulations evolve. While it might be hard to quantify the financial cost of ensuring compliance with regulatory requirements, it should not be too difficult to quantify the cost associated with losing accreditation, resulting in loss of reimbursement, or more seriously, the requirement to cease operations until compliance is achieved. Additionally, severe deficiencies can potentially result in the medical director losing their license for as long as 2 years. The cost to ensure compliance seems minimal when compared to the potentially insurmountable costs associated with losing your certificate and ceasing operations indefinitely. Regardless of the agency, all inspections focus on essentially the same areas. While being ready can't guarantee a stress-free inspection, it will indicate the laboratory has already adopted the culture of quality patient care and that it can continue to improve from there. Consider this an opportunity to find areas for additional improvement and embrace it. In summary, operating at an inspection-ready level is possible and may improve the overall quality, accuracy, reliability, and timeliness of patient testing results being produced by your facility. Regularly perform internal audits and mock inspections to continually assess your compliance with all regulatory requirements. Review past inspection reports and follow up on all deficiencies cited, ensuring processes and procedures have been updated, staff has been properly educated, and that your remedies remain effective while not negatively impacting any other processes. Identify most commonly cited deficiencies in the industry and prepare to satisfy those and all new survey checklist items. Stay apprised of the latest practice advancements and developments in the news to help you strategize for compliance as the TENS and regulations evolve in the future. And maybe the best tip, trick, or piece of advice I can share with you is to document everything and stay organized. I would like to wish everyone a happy Medical Laboratory Professionals Week, and I thank you for your time.